first off, I just want to say thank you for doing this.
Thank
This
you
is
for
really
having
helpful
me.
for me, and the point of this is that it's helpful for other lipedema patients
Absolutely.
moving forward. So, this is meant to not just be like, pat our backs about like how great we are here, but just to help someone that's never been here before, or someone that's just starting their journey with their lipedema
Yeah, and that's
recovery
why
and
I'm
surgery.
here, because I want to help others.
How can we help them get some good information that's like not biased? You haven't been compensated to be here or
Yep.
anything like that. So
Nope.
you're here just because this is something
Yep.
important to you as well.
Absolutely.
So thank you for that. We really appreciate it.
Thank you.
So I guess a great place to start would be introduce yourself.
My name is Suzanne. You had diagnosed me with stage 2 lipedema, and for several decades I didn't know what was wrong with me, and I have been on a search for knowledge for the past decade once I found out what lipedema really was, and came across you, and you've changed my life.
Thank you. What was it that let you know that something was off, or that you were changing, and how did you start to kind of come to the conclusion like something's not right, I need to figure out what it is?
It was way back in my teen years and early 20s. I was in the Navy, and I kept gaining weight in my legs specifically, and I couldn't figure out why, because I was like doing the most rigorous exercise routine. I was eating so clean and so healthy, and nothing seemed to make a difference. And it was just really frustrating. And every doctor I ever went to said diet and exercise, and that's what I knew too. And so something was always off, but I just kind of accepted that maybe that was my body type. And it was just a difficult thing to come to terms with, because I almost had to change my personality for the disease. I was a type A go-getter, and then all of a sudden I kind of couldn't really be that with all the weight I was carrying. So it was very difficult. But one day I was with my girlfriends in downtown Portland. We were walking around for a good hour or so, and it was really, really hot. It was over 100 degrees.
Yeah.
And we got back to the hotel room, and my legs were in so much pain, and I didn't understand why. Everybody else was fine. They were just hot. And I just Googled, we were just having some downtime, and I Googled painful fat legs. And all of a sudden the term lipedema came up. And it was a rabbit's hole. I completely went down this rabbit's hole and just found out all this information. It was insane how much knowledge there is out there once you know the term lipedema. And I started doing a lot of research and looking at studies and finding out for myself, because none of my doctors were able to help me.
Right.
So
that's one of the things, I can't remember if you and I have talked about this specifically, but it comes up a lot with other patients, that there's this cognitive dissonance with lipedema, where something is wrong, you don't necessarily know what to call it, and maybe unintentionally, but everyone's kind of gaslighting you a little bit, because they're trying to tell you to the best of their ability what's going on, but they don't really know, and that's not right, because you know what your reality is. And then once you hear the term, or once you see what it is, and it's like everything clicks into place, and all of a sudden it's like, oh my gosh, this is it.
Yeah, absolutely. It was a wake-up moment, and I just started looking at my diet, and I eventually went low carb, and that helped drastically. I got into compression garments, got one of those vibration plates. I was trying a bunch of different things, supplements. So I was trying to do a lot on my own, because I realized I was alone in this field, until I came across you, really.
Yeah.
So you helped me really have confidence that your diagnosis meant, oh, I'm not crazy,
Right.
This is not all in my head, I'm not making it up. And so it was just this huge, huge relief. I think I actually went home and cried after my first appointment with you, because it was so impactful and great that there was a name for it, and I wasn't making it up.
And it's not just knowing what to call it. You were lucky enough that your insurance was able to cover multiple surgeries.
Yeah, that was fantastic.
We took the better part of 6 months or so to do everything. And one of the big things that they wanted to know, they want to make sure this is a medically necessary surgery, because liposuction is typically associated with cosmetic surgery. So do you mind speaking to some of the functional limitations of the things that you felt like you couldn't do, or maybe ways that lipedema affected you? I know, back when you were in the military, that you had some issues with with your legs?
Yeah.
Anything you want to speak to on that?
I had to get out of the military because of my legs, and then after my pregnancy, just kind of gained more weight in my legs. So about a decade ago, I really started getting more pain and less mobility. So squatting down and getting back up, and then stairs were really hard. Inclines were a bit more of a challenge. Keeping up with people was a challenge. So I started to see a lot more mobility issues, and so it was really hard for me to start thinking about how I was going to go about surgeries. I'm so glad that my insurance did cover it, because I was a little bit worried about getting that. Since so many doctors didn't even know about it, to help me through that process. So I ended up doing a lot on my own until I met you, and then you helped me through a lot of the end stages of the insurance process.
Yeah, and I think the surgery itself, as best we know, is about the closest thing to curative treatment that you can get. The best studies, and I've talked about this in other videos, show that up to 12 years you still get the benefits regardless of whether you gain or lose weight, which, for you, you're in your prime working years, and your job, you're constantly kneeling down and working on things. And I think it just kind of helps to future-proof your career a little bit.
Absolutely.
To let you kind of do the things that you want to do, not just outside of work, but also just to make your livelihood.
Yeah, absolutely. I've got a teenage daughter, and so I really wanted to be able to keep up with her, and I was finding that I couldn't, and I really first came to you wanting less pain, more mobility. That's really all I had basic expectations for, and you blew those expectations out of the water, because I feel so fantastic. I feel like I've got a whole new lease on life now, and I've actually started, doing a lot more running, even with my dog, and I'm going to join a gym next month, and just kind of get back into it, and I'm looking forward to that.
That's great.
I've already found it so much easier to do my job and to keep up with my daughter. Yeah, it's been a really drastic change in my life.
Good. So I think some of the things that people associate with lipedema surgery, they talk about the heaviness and the pain, and how it makes it easier to move around and do the things that we've talked about. But one thing that I also hear from a lot of other patients is it makes it easier to sleep, or they sometimes feel like they have less brain fog. There's all these other things that are kind of nebulous that you wouldn't associate with heavier legs. Have you noticed anything outside of just exercise that feels different?
Massively. Well, I mean, just the little things like picking your legs up to get into a car. You don't think about that, but I there's a huge difference between now and then, know. So it's a lot easier now. Little things like my cat jumping on my lap. I don't have that pain anymore from, and the first time it happened after my surgeries, I tensed up, waiting for it, and I was like, oh my gosh, that didn't hurt. It was a weird thing. So
imagine how your cat felt.
I know.
Probably really excited for once.
Absolutely. So just weird little things like that. Just being able to move faster too. My legs feel so much lighter. And then I haven't even touched yet on the confidence level. I had no idea how much confidence this would bring back to me. So I feel like I needed that. I didn't realize that I needed that, but you have given me back so much just confidence to just move, you know?
Well, I mean, we've known each other for a little bit over 6 or 9 months now, and seeing you now versus then, I mean, you weren't a shrinking violet beforehand, but I can tell that you feel better about yourself. And I think that translates not into just, how you look at yourself in the mirror, but how the world perceives you, and that'll probably help with future job prospects, or just kind of how you present yourself to your children, your significant other.
Well, I'm a Girl Scout troop leader, as you know, and so just trying to be a good role model to them, to my daughter. I wanted to make sure that they can see that you can do hard things, and you can come out on the other side doing well.
Very cool. Let's talk a little bit about your experience here for the consult process, and then the different surgeries that you went through, because we did all of your surgeries here in our accredited facility.
Yes.
So what was that experience like? And I guess the first time, I don't know if you even knew awake surgery was a thing, but how did that go when we talked about it in the consult from your perspective, and then during and after the surgeries?
The experience overall was fantastic. I would go through all of it all over again if I had to, I was researching different surgeons in the area. It really made a difference to me that you were a board certified plastic surgeon. That was huge. Also that you had studied under other, well-known doctors in the U.S., or you knew other doctors that had done surgeries like this. And then when I first met you at the first in-person consultation, I was just blown away by your knowledge and your, what you knew about lipedema. That was a huge thing for me. But even more so, I was really impressed by your compassion and your patience with me, just answering all my questions, taking the time with me, making sure I was aware of what would happen, giving me options. You said we could go to a hospital and do general anesthesia if I needed it, but you were confident that it would work out well in the surgery center here with your team. And so your confidence led me to think, that was a great solution. And so I was happy to do that here, and it did work out very, very well. You and your team always made sure that my comfort levels and my safety were just the top priority, and made sure I was just comfortable at all times.
Yeah. We were always thrilled to see you on the schedule for your surgeries, because everything always goes so smoothly with you. You barely feel like pokes from needles, and you're cool as a cucumber. We're like, oh, thank goodness Suzanne's on the schedule today. It's going to be a great day. So we always looked forward to it.
I looked forward to coming in too. It was always a little bit nerve-wracking to go in for a surgery, but you made me feel as comfortable as possible.
Yeah.
So, and you always had backup to, what's the gas that you use? The
nitrous
oxide. Yeah,
I
never needed that until I think the fourth surgery or something.
Yeah.
But you always had backups, and your team it was just almost a fun adventure to have surgery here.
Right. It is like a little bit of it's very anxiety inducing, because it's still a procedure, and I take my part very seriously, but I can focus on what I'm doing because I've got the team that's all focused on you and keeping you, telling jokes, telling stories, so that I can do my own thing and worry about the surgical results. So it's certainly a team effort.
Yeah, no, it was always enjoyable to come in and see everybody, and it was just like, seeing old friends.
Good.
Yeah.
And then the not so fun part is usually the recovery after surgery. And some can all, be a little bit worse than others, but can you speak to the recovery and kind of the drainage and all the not so fun stuff that
what has
afterwards?
Been helpful is just I belong to a bunch of groups on Facebook where women have shared their experiences of different surgeries, and oddly enough, some of the advice was get a shower curtain liner, and put that in your bed, and little things like that were helpful. But just being physically prepared, I knew my low carb diet was, I think, helpful, keeping me ready for it physically, and then just making sure protein and electrolytes after the surgery. You gave me arnica and bromine. That was helpful as well. But yeah, the recovery was a little challenging. The first, I would say at least 4 to 5 days were the worst. And then after that, it was just more of a normal recovery, but just getting over that hump.
What do you think was the most challenging part about it? Or I guess something that maybe you didn't expect? Because it sounds like you did a lot of research and you at least knew sort of what to expect, but what was it that you found more challenging than anything else?
This is a bit embarrassing to say, but the first bowel movement after surgery.
Yeah, right.
That was challenging. Just taking the time to heal. I think I wanted to move so fast again, and my life is usually so fast, so I wanted to get back into everything, but just taking the time to actually just lie in bed for days on end, that was hard. Yeah. But also getting up and moving around and making sure that I was moving my legs. What was weird about the long-term recovery, I was not mentally prepared for the good version of body dysmorphia.
Right.
Because every time I would pass by a mirror, I'd be like, oh, whose legs are those?
Yeah, right.
And it was a shock, that's strange. I'm not used to looking at those legs, because for decades I had these really big legs. And I just had to keep telling myself that these were my legs.
Yeah.
And this was my muscle definition. Right. And it had been there all along, it was just buried under the lipedema tissue. So.
And to your point earlier, that confidence, that it's reinforcing, it's not just that you feel better, but then you can see the results pretty quickly in the mirror, and it's oh, okay,
it's a very
kind of reinventing yourself a little bit.
It's a strange thing, but a good thing. It's kind of surreal.
What has your your support system thought about everything? You know, your family, your significant other,
They've been
your daughter?
great. They've been really great. Yeah, my family, my husband, my daughter, my father-in-law, they help me with the dog. They help me with the house. My boss has been amazing, absolutely wonderful, giving me time off for each surgery to recover.
Yeah.
Very understanding, yeah.
And are you getting any, not just compliments, but like any feedback from those in your support group, like, hey, like not just like you look great, but like,
Yeah.
you know, oftentimes significant others can tell the difference. They're
Yeah.
like, wow, like you did that thing. I
Yeah.
can't believe you did that thing.
Yeah, it's been pretty epic, actually. It's been nice to get the compliments and just to see people see me move easier, you know, and yeah, people have made a comment on that, oh, you look like you're doing so much better.
Good.
Yeah.
That's really good. To close up, if you wanted to speak to someone that's either just finding out about lipedema, maybe this is like the first video that they'll ever see, or they're just trying to figure out like what to do you have any recommendations for someone that's just starting out on their journey, like any helpful advice that you would want to have known when you were first starting out?
I found that the Facebook pages, you know, there's like a Northwest Lipedema page, and there's a variety on Facebook that are very, very helpful at getting people's individual stories and just finding out what worked for them. That's really how I learned a lot of, you know, the past decade. I learned a lot of the self-care from there. I did my own research. Some of those studies and research papers are pretty thick and hard to read, but I tried to work my way through those just to see what would work best for me. Read a lot of articles, you know, tried to find good information online. But after several years of doing the compression and the diet, I was really ready for the next stage. So I would say take your time in this process. It really is a process. So start some of the conservative treatments, you know, on your own. And the easiest thing is to find a doctor who really believes in you and knows about this. So it's very beneficial to have found a doctor that can support you and help you, you know, realize what this condition means.
Yeah, I think for me, one of the things that I really pride myself on is finding a custom plan for every patient, because people are going to be at different stages in the journey. You know, some people are just finding out about it. Some people have known it's been going on and they just haven't found the right person that kind of connects with them. So, you know, you don't want to be prescriptive in the surgical plan, because everyone's got different aches and pains, or they've got a different job, and, you know, the things that they want to do is different. So coming up with a custom plan is something I think is very, very important. And just finding something that's going to fit in. You know, it's not like you have to do everything like we did with you very rapidly. We could spread this out over time. We could do it in a hospital, a surgery center. So, you know, I think for me, speaking to future patients or prospective patients, there's almost always something that we can come up with that's going to fit their schedule. And I think that's really important, because otherwise you're trying to fit somebody into something that doesn't really match with their lifestyle. And I think, you know, for something like this, it's a very personal diagnosis, and it affects people in a lot of ways. It touches a lot of different aspects of their lives. So to get them feeling better and kind of treat all aspects, I think you have to come at it with a very holistic approach.
Absolutely.
You know, what's going to work for this patient.
I was so grateful to you that you asked me which area I wanted to start on first. I mean, that was huge, that you were taking my input into it, you know, and you really guided me through, you know, just all my questions that I had for you, and, you know, what did you suggest happen? And you're like, well, you know, what's the most painful part? And, you know, so we started on my hips. That was pretty drastic. My pain level's gone like nearly all gone in my hips, and maybe like 10% left in my back. So that was pretty drastic. We started there and we ended there on my hips, and so that was a great, you know, great way to kind of plan it out, I think.
Great.
That was helpful.
Thank you again for doing this. This is a lot of really good information. I think that it's really going to resonate with a lot of patients, both during the process as well as if patients find this beforehand. I think it's good to have just a very candid discussion about things.
Yes.
You know, again, you haven't been compensated for doing this. So you're doing this because you care. I'm doing this because I want people to find out more information and good information about lipedema. So thank you again.
Yeah, thank you for having me.